Cholesterol. Every one of you has heard about this substance. How dangerous and harmful it is for our bodies, how it accumulates in us when we eat. And a very important point, it leads to our death because it clogs our blood vessels, resulting in strokes and heart attacks. I am Dr. Vasyl Chaika, and today let's figure out together whether cholesterol is really as bad as they say. Is it truly harmful, and what should we do to keep our blood vessels healthy at home without medication? So, the first misconception is that cholesterol accumulates from the food we eat. After all, it's fatty foods, fatty meats, and poor diet that are believed to raise our cholesterol levels. But in reality, that's not the case. Why? Because 3/4 of our cholesterol, that is 75%, some scientists even say 80%, is produced in our bodies by our liver. And what's very important is that this cholesterol is necessary for the production of a substance called bile. And only just 25% of cholesterol enters our body from external sources. That's why regardless of our diet or how much fatty food we eat, the level of cholesterol in our body does not change. Another proof of this is that a huge number of experiments have been conducted on people who, for example, lead a healthy lifestyle. Even if they eat, for instance, low-fat food, their cholesterol still increases. There were even experiments conducted when people were starving, for example, during World War II or during famines that occurred. Their cholesterol levels also increased, even though they were not eating fatty foods and actually had a shortage of food overall. That is, cholesterol does not depend on food intake or on what you eat. It doesn't matter at all what foods you eat. And this is very easy to verify. For example, in meat, fatty meat like pork, for instance, according to the literature, there is about 80 milligrams of cholesterol per 100 grams. And in that very same, let's say, therapeutic, very healthy product that's recommended for lowering cholesterol, like ghee, for example, there is 4 times more cholesterol. For example, there's a lot of cholesterol in fish. Fatty meat actually has less cholesterol than fish. So in fact, it's the opposite of what you'd expect. All this data proves that it doesn't matter what you eat. The reasons for the occurrence and increase of cholesterol are completely different. And now we're going to talk about them. So first of all, cholesterol serves a protective function in our body. It acts as a biological glue in our body. So what is this biological glue released for? In other words, when our cholesterol level rises, it simply means our body has an increased need for this biological glue. For example, when a pipe bursts and water starts leaking, say in the bathroom or somewhere else, we need to seal that pipe using some kind of sealant. Cholesterol in our body performs exactly the same function as that sealant. And so, if a blood vessel starts to leak somewhere, meaning blood plasma escapes beyond the vessel, the liver immediately begins to increase cholesterol synthesis. This happens quite often, for example, in young people, someone who is 20 or 25 years old, and they have elevated cholesterol levels. She doesn't smoke, doesn't drink, exercises, yet her cholesterol level is high. Why? Because the permeability of the vascular wall is increased. We'll talk about the reasons for this a bit later. But for now, let's look at what else can lead to elevated cholesterol levels. Another factor is stress. Yes, it's something each of us experiences or encounters every day. At work, at home, on the street, in the store, it doesn't matter where. It's constant stress. Stress leads to a need for more stress hormones. Adrenaline, noradrenaline, cortisol. And interestingly, in order for these hormones to be produced, cholesterol is necessary. That's why, of course, cholesterol levels rise if we remain under stress for a long time. But increased stress leads to vascular spasms. Blood vessels in prolonged spasm cannot recover quickly. And so, of course, their walls weaken and blood plasma can leak out. In other words, this leads to a disruption of the integrity of the vascular wall. And again, the need for cholesterol increases. And cholesterol increases again. For example, we need cholesterol when we are thinking intensively. After all, cholesterol is a component of serotonin. And if there is not enough cholesterol, we have trouble remembering information. And the example is very simple. When we take drugs like statins, does our memory get worse? Why? Because statins lower cholesterol levels. Next, cholesterol, for example, is part of sex hormones. So when we have an active sex life, when we have intimacy with our partner every day, our cholesterol will normally be elevated. And that's a good thing. This is a very good, positive indicator because sex hormones require a lot of cholesterol. Cholesterol is also present in every cell of our body. In other words, cholesterol is essentially a building material from which cells are made. For example, cholesterol is also necessary for the synthesis of vitamin D in our body, which people are constantly trying to supplement nowadays. You could drink a bucket of synthetic vitamin D, but it won't be absorbed by your body. After spending time in the sun and increasing your cholesterol level, what will be absorbed by your body right away? Vitamin D. What else is very important? That cholesterol is a component of bile acids. We've already talked about this. Bile, for example, stimulates peristalsis. Therefore, if there is, for example, impaired bile flow and reduced peristalsis, such as with constipation, then of course the cholesterol level will increase. For example, when people don't eat fatty foods, when they don't eat spicy foods, when they don't eat sour foods, this leads to an increase in cholesterol levels because bile does not flow out. So I want you to understand just how wrong all of this is and how much we need to change our approach and attitude toward cholesterol. But how exactly does cholesterol work in our body? After all, there is a statement nowadays that there is good cholesterol, the so-called low-density and very low-density lipoproteins. Or rather, quite the opposite. There is good cholesterol, which is high-density lipoprotein and very high-density lipoprotein, and bad cholesterol, which is low-density lipoprotein and very low-density lipoprotein. This is a theory that today it is dominant. But just 20 years ago, all cholesterol was considered dangerous, and it had to be lowered. I just want you to think about this. In medicine, theories change, but unhealthy cholesterol and its significance in the body remain. And here, look at this interesting fact. For example, how does what we call an atherosclerotic plaque, which blocks our blood vessels, form? If somewhere, for example, under the influence of stress or a disruption in bile flow, thank you. Or any of those other factors we mentioned earlier, if something causes the integrity of the vessel wall to be compromised, then in that case, more cholesterol is needed and the liver starts to produce it. Yes, of course, your taste preferences may even change and you'll start craving foods that contain more cholesterol because 25% of cholesterol comes from external sources, and that's normal. And here's what's interesting. When plasma leaks out, you need to patch up that little hole. And how does this happen in our body? First, low-density lipoproteins arrive at the site. In fact, these substances act like a reinforcing mesh. Just like when we make concrete, it consists of cement and reinforcement, that is, a framework. And in our body, this framework of the atherosclerotic plaque is formed by low-density lipoproteins. They are very dense, very sticky, and they adhere to the spot where, let's say, the plasma leaks out. On top of it, high-density lipoproteins accumulate, and in this way, an atherosclerotic plaque is formed. So, for example, if there are no low-density lipoproteins, the plaque will not form. If there are no high-density lipoproteins, the plaque, it also won't form. So, only when both types are present does a protective atherosclerotic plaque form. But of course, they use this plaque to scare you. After all, this plaque can block the vessel's lumen, and then that's it. You'll die. This is yet another myth. Why? Let's debunk it again right now. I am convinced that in today's world, in order for a person to be healthy, only a comprehensive approach should be used, one that addresses the physical level, the level of perception of information and the world around us, as well as the behavioral level. Because our blood vessels are biological pipes, unlike sewage pipes. Sewage pipes, or even a paper tube like this one, don't have the ability to expand, but our blood vessels can expand. And you can easily check this yourself. For example, by feeling your own pulse, every second you have a pulse. Your heart contracts at a certain rate per minute. And you can feel these contractions. What happens? The heart pushes out a portion of blood, the vessel stretches, and this blood moves further through the body. That's what happens. This is how the pulse wave stretches. This is how the vessel works. And you see how much space is still left inside. Therefore, if an atherosclerotic plaque blocks, for example, part of a vessel, even up to 90%, thanks to this mechanism of vessel stretching, there is no disruption of blood flow. This is one of the pieces of evidence. The second piece of evidence that disproves all these theories is that, for example, the diameter of your cells erythrocytes is 7 micrometers, while the diameter of the capillary through which these erythrocytes pass, and capillaries exist even in large vessels. For example, there are capillaries in the aorta, in the brain, and all metabolic exchange and absorption happens through them. The exchange of microelements happens precisely at the level of the capillaries. The diameter of a capillary is only 5 micrometers. So an erythrocyte, which is larger, normally cannot squeeze through such a tiny capillary. Otherwise, we would all die, all our vessels would be clogged, it would be a disaster. But for some reason, this doesn't happen. Why? Because your erythrocytes are able to stretch, because your capillaries are able to stretch. This is where the essence of deceiving people lies. That's why I want you to understand these points. But today, natural, biological, and proper methods of working with cholesterol are not being used. Because you need to deal with chronic stress, you need to normalize your diet, you need measured physical activity, and for example, with the help of certain means or methods, you need to improve that very same outflow. Bilious. All this will contribute to normal cholesterol levels. But we offer one thing. These are drugs called statins. And what do these statins do? Statins do not reduce cholesterol level. They arise in an effect called the squeaky spring effect. There is a certain level of cholesterol that the body raises as needed. Once again, I want you to understand that the body increases cholesterol because there is some need for it. Somewhere to patch up a vessel, somewhere it's needed. More sex hormones are not produced because there is a lack of vitamin D. Somewhere more bile acids are needed, and so on. When the need increases, the liver increases cholesterol synthesis and your taste preferences also change. But when an atherosclerotic plaque has formed and it stabilizes, statins, when we take them, are able to destroy this atherosclerotic plaque. Which one? Which? How? First, they disrupt the integrity of these low-density lipoproteins. And then this atherosclerotic plaque, when it contracts here, can break off and cause thrombosis, for example, or embolism of the coronary arteries, or for instance, the pulmonary veins. And then there will be a stroke, for example, or a heart attack, or thromboembolism, for instance, of the pulmonary artery. But in this case, it's not cholesterol that's to blame, but rather the statins, which disrupt the stability of the atherosclerotic plaque. So when we look at the medical literature and research, for example, cholesterol was discovered more than 20 years ago, but the number of heart attacks and strokes has not decreased. And to this day, people, or rather doctors, still don't know why that cholesterol level rises. And there are already many articles that say there is no need to lower it. That cholesterol is actually a proper substance in our body. It helps. You just need to create the right conditions for this cholesterol to perform its protective function. Another important element is the effect of a compressed spring. What is that? Cholesterol level. It rises, we take a statin, and it holds the upper limit. But the liver increases cholesterol synthesis. So the medication holds the plateau from above while the liver pushes up. The liver can raise cholesterol to a certain level, but no higher. And now the spring is compressed. A person has been taking statins for a certain period of time. It seems like their cholesterol has dropped and they think, why keep taking it? Because when I take cholesterol, my memory gets worse. Now we already know why. We take cholesterol, libido drops. We know this because cholesterol, or rather statins, lower cholesterol, and then the level of sex hormones drops. We take statins and vitamin D synthesis is disrupted. We take statins and liver function is impaired. We take statins and the gastrointestinal tract is disrupted, constipation and so on. So a huge number of problems. He says, why do I even need this? I won't take anything. And he stops taking them. And here is this plateau. When the spring was compressed, it shoots upward. And again, a lot of this cholesterol will be produced. And what happens then? It can also block the vessel. The problem isn't cholesterol, the problem is the medications, the statins that people take. So should you take statins? No. And should you lower your cholesterol level? No. You need to create conditions so that cholesterol can perform its protective function on its own. But if you are under stress for a long time, if you eat poorly or incorrectly, if you don't consume foods that promote bile flow, or for example, if you lead an unhealthy lifestyle, all of this will lead to an increase. Your cholesterol level. Therefore, by changing these factors, your cholesterol level will change as well. But in order to stabilize an atherosclerotic plaque, you can get a prescription. So, in order to help stabilize atherosclerotic plaques and stop plasma from leaking outside the capillary, we need to create conditions for faster healing. And we can achieve this with a very simple recipe, which you will now see on your screens. That is, by using this recipe and taking just 5 milliliters daily, which is a teaspoon, of this infusion, you will be able to strengthen your capillaries, your blood vessels, and the atherosclerotic plaque. And by using this simple method, you will have healthy blood vessels. And in this natural biological way, we can have normal cholesterol levels. And once again, I want you to remember, neither food nor medications will make your cholesterol right. Only by changing your lifestyle will you have healthy blood vessels. And remember, cholesterol does not clog your blood vessels. Cholesterol is a biological glue that ensures their stability. So you shouldn't be afraid of cholesterol, you should befriend it. That's exactly how it is. This was Dr. Vasyl Chaika with you.